All right, it's time now to ask the expert. Here to answer your pet questions live on air is Brett the vet. Okay, our first one is Ben in Phoenix. Any advice on helping your dog overcome travel sickness? How can I help my dog remain calm while traveling? A golden.
Is this the Ben that forgot to bring his dog to the vet clinic that day? Oh, he's grown up. He's looking really cute.
I know.
So Ben, good job. He's growing. He's looking very healthy. Most important, you see how his eye line here is above the window. Oh. If he can't see, it's kind of getting car sick. So make sure he can see. Take him on short drives so he gets used to, and we use that word desensitization, so he gets used to the car. Okay. So short trips on the weekend when you have some free time, let him see where he's going and make sure you're driving calm and
yes,
gentle.
not erratic, right? Is it okay to lower the window or no?
A little bit.
Okay, not too much.
Okay, but
all
no
right.
head out,
okay.
No drives.
Okay, all right, good to know. Marianne from Casa Grande says, my pit bull has had valley fever since we rescued him 5 years ago. His titer levels remain at 1 to 2. Could this shorten his life? I'm not familiar with titer levels.
Titers are how we evaluate the strength of the disease in the body, so to speak. We want a low titer. Pit bulls get valley fever. One big thing, Mary, is if you're using compounded drugs, which might be a capsule or come from a compounding pharmacy, they don't work as well as the same thing we would take if we got the disease. So make sure you're looking at FDA-approved human generic fluconazole. The right drug at the right dose can fix almost every one of these dogs. Lastly, I'll say, there is a vaccine on the horizon from a company called Anaviv, and I know they've got the web link to that. You can go onto that website and participate and be a champion for newer technologies that show promise for valley fever treatment.
Okay, do you remember that website?
It's www.anaviv.com.
Okay.
Anaviv.
Anaviv.com. All right, Nan from Scottsdale says, my dog Henry was diagnosed with pneumonia. I believe my dog got this respiratory illness over Thanksgiving at day camp. After a trip to the emergency vet, he is home and survived, thank goodness. My question is, are dogs immune to this after they get it once? What are the chances he will get that sick again if in a group day camp like this?
Great question, Tram. I'm glad he's doing well, Nan. So sometimes when you get exposed, you do develop immunity. However, there are so many viruses, bacteria, and fungal diseases, dozens of them. And this new one, the Mysteria illness, could become another one that we have to worry about. So you can get re-exposed potentially. Okay. So good vaccine, the fact that we did do well after that clinical disease is promising. If you choose to re-engage just for his emotional health, which I would personally feel comfortable doing, just watch for those signs again, runny nose, etc., and go in and see your vet if you get more respiratory disease.
Is it a good idea if she goes back to that day camp?
Great question. I think good daycares, a lot of people have questioned vaccines, and we've been a little complacent with this. This is a situation where I think vaccine for kennel cough should be required by all pets going into those concentrated areas, because that will reduce risk.
Okay, good to know. And Shannon from Gilbert says, my dog is being treated for a respiratory issue, pneumonia, nasal discharge, and coughing, hacking, and it's not going away. What's the antibiotic or treatment plan that is helping dogs with this new bacterium?
Well, Shannon, what we've learned so far is we don't know if this is a virus or a bacteria or a complex of it all. There are antibiotics, doxycycline. Some suggest this one drug called chloramphenicol. Don't be afraid of it. We use it a lot. And a little bit of steroid. Now, I will say one thing. Shannon, I did speak to our state veterinarian this morning. They are in the process of putting together a document for all Arizona veterinarians, a guideline document about test and treat options, as well as sample submission to our National Veterinary Lab in Ames, Iowa.
Wow.
So we can decipher this code and hopefully more quickly get information. The more we participate as an organization, as pet owners, hopefully sooner we'll identify and be much more effective in the treatment. Good luck with your dog.
Yeah, no kidding. And thank you so very much. You know what? We still have a lot more viewer questions, but we're going to answer them when Brett comes back again, just like, I don't know, maybe in a couple of weeks or so. Always so popular with our viewers. So thanks to our viewers.
Thank you, and we'll update you on all these things.
Absolutely.